I have hemifacial spasms which are treated with Botox. Can I have Juvederm or Voluma for cosmetic purposes with this condition?
Thank you for your question. You state in your question that you have hemifacial spasm, which you treat with Botox, and you're asking, can you have Juvederm Voluma, understanding that you have this other condition occurring concurrently, the hemifacial spasm? Well, I can certainly share with you my approach to patients like yourself. I'm going to give you a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I could tell you that original use of Botox and the group of doctors who were the first to use Botox were actually oculofacial plastic surgeons, and the original use of Botox was for conditions like yours, hemifacial spasm and a condition called benign essential blepharospasm. So this is something that I was very familiar with, and I've treated a lot of patients with these muscle spasm conditions long before the indications for cosmetic eventually made Botox the #1 non-surgical cosmetic procedure. So let's understand what the interaction is and why there would be a potential issue. But frankly speaking, we're talking about two different classes of a filler or a way to approach cosmetic problems. Voluma is a filler. It adds volume in the places that you place it. And of course, Botox is a neurotoxin, and it prevents certain muscles from contracting. So I can understand that you could be concerned that maybe if you placed a filler, that it could cause some type of local issue that can worsen your condition. So I would just share with you my approach to how I would use a filler like Juvederm Voluma, typically for somebody regardless of whether or not they have a facial spasm, but in what relationship to the muscles this would be. So when you talk about hemifacial spasm, you're basically looking at one side of the face and the eye muscles contracting and the muscles that lift the cheek and the outer part of the lip contracting in an uncontrollable way and is relaxed with Botox. So if I were to place a material like Juvederm Voluma, my preference would be to place it at a deeper level, actually below the muscle on top of the bone. And basically, I suspect that you're asking about Voluma specifically because you want to improve the mid-face area, the cheekbone area. And so I feel like there's an advantage to placement at the bone level in that the muscles actually glide over the material, and that the muscle doesn't actually negatively impact the material, but rather helps make the material shape well with the bone structure. It also allows for a significant amount of stability in terms of the longevity of the material. When I place it at the bone structure level, the material can actually last up to 2 years. And that there's an advantage there, which means you don't need necessarily as frequent injections or as much volume if you needed a repeat injection earlier than the 1 to 2 year time frame. And then when it comes to the relative position in the soft tissue, let's say you put it in just the cheek soft tissue, the malar fat pad, or just a more superficial level, potentially if your spasm increased and you're constantly squeezing, which is different than a person's normal facial movements, theoretically there could be more, let's say, pressure forces and shearing relative forces that can maybe displace and shift the material. It's a theoretical idea, it's hypothetical, but it does have a certain validity based on the anatomic placement. So for me, from my point of view, I would put it at a deeper level. So, but from a medical perspective, in terms of any interaction with the Botox, I would say there would be none. And from a safety point of view, I think it's completely safe to do. And again, without knowing the rest of your medical history or any other details of your situation, I would say that, assuming everything else is good, that it's not likely to be problematic. Speak to your doctor, the doctor that performs this, and if it's most likely would be a neurologist or an oculoplastic or oculofacial plastic surgeon doing the injectables for the Botox, then they may or may not be doing the injectables for Voluma or other things. So if you need to go to another doctor for the injectable filler, just run it by your doctor who does the Botox for you, just to make sure that they don't have any other concerns that I don't know from the details of your question. That's just to be safe. So I hope that was helpful. I wish you the best of luck, and thank you for your question.